Hi, my name is TIESO-ECHEVARRIA, and today I will be talking about how can we effectively prevent and treat metastatic cancer. 90% of cancer-related deaths are caused by metastasis, the silent spread of cancer from its original site to distant organs, claiming life and leaving families shattered around the world. This reality impacts not only the patients, but also their families and communities, which is why understanding how to prevent and treat cancer, especially at its metastatic stage, is vital for you. As a biology student passionate about cancer research, I have studied how the tumor microenvironment influences cancer progression and how new strategies can make a real difference. Therefore, I want my audience to understand the prevention and treatment strategies to counteract metastatic cancer by examining the role of the tumor microenvironment and considering innovative therapies such as gene therapy and nanoparticles combined with immunotherapy. The first key aspect to discuss is the role of the tumor microenvironment, the true silent accomplice of cancer. The tumor microenvironment (TME) is the immediate environment where the tumor develops, composed of molecules and cells that can promote or limit the growth and spread of cancer. When you understand how changing the environment of the tumor can stop cancer from surviving and spreading, you realize why developing more effective treatments matters. There is a framework for a new multi-pronged therapeutic approach. This approach focuses on modifying both the primary and distant tumor microenvironment to make them less hospitable to cancer, while enhancing the immune response to achieve better outcomes. In modern therapy, the goal is not always to eliminate completely cancer, but to keep it stable and prevent its spread by targeting its microenvironment. Treatments like vascular normalization and immunotherapy help turn cancer into a manageable condition. Vascular normalization is a therapeutic strategy that aims to restore the normal structure and function of blood vessels within the tumor. Similarly, immunotherapy is the treatment that stimulates the body's immune system to recognize and attack cancer cells. The tumor microenvironment regulates essential tumor survival and promotion functions. Interactions between the cellular and structural component of the TME allow cancer cells to become invasive and disseminate from the primary site to distant locations. Through a complex and multi-stage metastatic cascade, so targeting the TME is essential to prevent metastasis. Since TME is composed of many variables, there are several ways to treat the tumor microenvironment and prevent metastasis. Several treatments target components of the tumor microenvironment, such as platelets and macrophages. Just as there in this new therapeutic approach directed at the environment, there are also innovative treatments that have proven effective and that are not strictly directed at the microenvironment. The second and final key aspect highlights innovative treatments, such as gene therapy and nanoparticles combined with immunotherapy, which are revolutionizing the way metastatic cancer is tried today. By exploring innovative treatments like gene therapy and nanoparticles combined with immunotherapy, you understand how directing therapy selectively and enhancing immune response can offer more effective and safer options against metastatic cancer. Advances in cancer therapy need a novel therapeutic agent with novel mode of action, several mechanisms of cell deaths, and synergy with conventional management. Gene therapy possesses all of these profiles. Gene therapy introduces genetic material to stop cancer cells growth. For instance, Rexin The first targeted injectable vectors for metastatic cancer stops tumor cells in their growth phase and induce cell death. Nanotechnology holds tremendous promise for improving immunotherapeutic outcomes in patients with metastatic cancer. In contrast to conventional cancer immunotherapies, rational design nanomaterials can trigger specific tumoricidal effects, thereby improving immune cells' access to major sites of metastasis such as bone, lungs, and lymph nodes, optimizing antigen presentation and inducing a persistent immune response. Nanoimmunomodulators are specialized nanoparticles engineered to regulate or enhance the body immune response against cancer cells. Nanoimmunomodulators can not only effectively eliminate the primary tumor but also exhibit superior inhibitory effects on distal metastasis and prevent recurrence. Nanoparticles are extremely small particles, typically between 1 and 100 nanometers in size, designed to deliver drugs directed to target cells. Stimuli response nanoparticles, SRNPS, combined with immunotherapy, offer the possibility to amplify anti-tumor immune response where the weak acidity, high concentration, and glutathione overexpression of enzyme reactive oxygen species and external stimuli in tumor acts as trigger for controlled drug release. The design of SRNPS is based on the tumor microenvironment and or external stimuli to combine with different anti-tumor drugs, especially the immunoregulatory agent, which eventually realize synergetic immunotherapy and malignant primary or metastatic tumor and acquire a long-term immune memory to prevent tumor recurrence. Although these innovative treatments have marked different progress in the treatment of metastatic cancer, we cannot ignore emerging approaches targeting the tumor microenvironment aiming at prevention and treatment. We now understand how the science and research help us prevent and treat metastatic cancer. From understanding the role of the tumor microenvironment to apply innovative therapies such as gene therapy and nanoparticles combined with immunotherapy, we have clear tools to fight this disease. With this knowledge, we can move toward a future where fewer people suffer or lose their life to metastatic cancers. As Joe Wester says, cancer is only going to be a chapter in your life, not the whole story. For any additional information, can you contact to Comprehensive Cancer Center in this slide? You can see the website and the phone number. This is my list of reference, and thank you for your attention. Bye.